Why is it important to vaccinate your child? Vaccinations for children save lives as well as keep our community healthy at a low cost. I want every child to be vaccinated regularly. Let me begin by sharing about how vaccinations can save lives. In the United States alone, approximately 42,000 out of the 4.1 million children born each year will die early deaths as a result of disease that could be prevented with vaccines. They have kept children healthy and saved millions of lives for more than 50 years. Most childhood vaccinations are 90 to 99% effective in preventing disease. We know that vaccinations work because of lower disease rates, as well as extinct diseases in the U.S. because of vaccinations, such as polio. And symptoms of diseases are far less serious if vaccinated. This is because memory cells begin working immediately. Vaccinations are safe. Before getting licensed, vaccines go through several testings by the CDC and FDA. Vaccines have to meet standards before they are ever administered to anyone. Safety is number one, as well as effectiveness. Regular inspections and tests in locations where immunizations are made. Vaccines are necessary because if you aren't vaccinated, you open doors in the community to spread diseases. Vaccinations cut the risk of illness by more than half. According to 10 Reasons to Get Vaccinated in 2019, vaccine-preventable infections are dangerous. Every year, approximately 50,000 U.S. adults die from vaccine-preventable diseases. Community immunity, what is that? Think of germs as rain and vaccinations as raincoats. You can still get wet with a raincoat, so you need an umbrella. The umbrella is the community immunity. Those who don't get vaccinated rely on others to share their umbrella when it rains. Infants rely on parents to offer protection by sharing their umbrella. If 90% of people are vaccinated in a community, the risk of a disease is very, very slim. Now let's move on to discuss the locations of getting immunizations. Primary caregivers, low-income clinics, health centers, and pharmacies offer vaccinations for adults and children. The initial cost without insurance comes to an average of $59 a visit. Low-income clinics and health centers offer free or reduced prices. According to Where to Go, federal-funded health centers provide a variety of healthcare services, including vaccinations. You can go to a health center if you don't have the health insurance, and they may offer sliding fees based on your income. Finally, let's talk about how vaccinations don't just stop as a child. Things you need to know about vaccines says, even if you get all your vaccinations as a child, the protection of some vaccines will decrease over time. Getting vaccinations while you're pregnant is a great choice. It offers protection for the baby before it's born, and it offers protection for the mother against whooping cough and the flu. Vaccinations for adults help maintain health as the body begins to weaken with age, meaning weakened immune systems just like a kid. Disease symptoms also worsen with age. Now let's summarize. Vaccinations for children save lives and keep our community healthy at a low cost. They are important for the safety and health of our babies and our future generations to come. Knowledge is power. Now that you have all this information, I hope you will vaccinate your child.